Hello everyone, welcome back to I the Pharmacist. In this video we will explore the two approved and authorized treatments by FDA and EMA for androgenic alopecia. Warning! This video content is made for informational and educational purposes only. The video content is not intended to substitute for professional medical advice, diagnosis or treatment. Please refer to a physician or other qualified healthcare professionals if you have any questions regarding a medical condition. Also remember, the effectiveness of these two treatments may vary from person to person, so it's essential to consult a healthcare professional for personal advice. So let's begin with the first treatment. It is a topical treatment. The only topical treatment for androgenic alopecia approved by the FDA and EMA is topical minoxidil. It's available over the counter in various forms, including topical solutions and foams. Here's what you need to know about minoxidil. The liquid form of topical minoxidil contains alcohol and propylene glycol. These are crucial for helping dissolve the drug and for facilitating tissue absorption. The formulations containing 2% and 5% minoxidil commonly treat scalp alopecia in individuals aged 18 and above. And the main question is how minoxidil works. Actually, the exact mechanism of action of topical minoxidil in promoting hair growth is not fully understood. Minoxidil affects the potassium channels present in vascular smooth muscles and hair follicles. This potassium channel activity may induce the following effects. Firstly, dilate blood vessels. Minoxidil acts as a vasodilator, which means it widens blood vessels. It may increase blood flow to hair follicles, providing them with more nutrients and oxygen. Secondly, shorten the telogen phase. Minoxidil may help extend the anagen growth phase of hair growth cycle while shortening the telogen resting phase. This can result in more hairs in the active growth phase. Thirdly, inhibition of androgen-related effects on androgen-sensitive hair follicles. Lastly, induction of the vascular endothelial growth factor expression. This means increased vascularization around the hair follicles. Now, what are the benefits of topical minoxidil for hair loss? Firstly, it's effective for both men and women, since minoxidil is approved for use by both men and women. Secondly, you don't need prescription for it. It's available over the counter without the need for a prescription. Thirdly, minoxidil is easy to apply topically, typically twice a day, and comes in different forms such as solutions and foams. Fourthly, it stabilizes or improves hair loss. Minoxidil is effective at slowing down hair loss and promoting the regrowth of hair in some individuals. It's important to mention that it is particularly useful in the early stage of hair thinning. And now, important considerations and tips. Firstly, consistency is key. To see results, it's important to use minoxidil consistently. This means applying it daily or as directed by the product label. Patience. The initial outcomes of minoxidil will become noticeable after approximately 8 weeks of initiating the treatment, with the maximum effects manifesting around 4 months. Bear in mind that minoxidil is typically used as an ongoing maintenance treatment. Discontinuing its use may result in a gradual return to the previous pattern of hair loss. Also, it's important to note that some individuals experience an initial shedding phase when they start using minoxidil. This is often a sign that the treatment is working, as it may push out weaker hairs to make way for thicker, healthier ones. There is something interesting to note, and that is that there is an enzyme called sulfotransferase that is in the scalp, and it actually converts minoxidil into its active form, minoxidil sulfate. Differences in this enzyme activity among individuals can affect minoxidil's effectiveness. And now we are moving now to the possible side effects. While rare, some people may experience side effects such as scalp irritation, itching or dryness after applying topical minoxidil. It's important to know that if these side effects persist or become severe, it's advisable to discontinue use and consult a healthcare professional. Also, long-term use of minoxidil is necessary to uphold achieved clinical outcomes, as these effects might diminish when the drug is discontinued. It's also important to know that minoxidil is most effective for individuals in the early stages of hair loss or those with diffuse thinning. It may not be as effective for individuals with advanced hair loss or those whose hair follicles have completely miniaturized. And now we are moving to the prescription medications. Currently, only oral finasteride is approved by the Food and Drug Administration and the European Medicine Agency for the treatment of androgenetic alopecia. Finasteride is an oral medication that needs a prescription from a physician, and it is used to treat androgenetic alopecia and benign prostatic hyperplasia. Androgenetic alopecia, as explained before, is a hereditary form of hair loss often referred to as male pattern baldness. Its pathogenesis is related to the binding of dihydrotestosterone DHT to androgen receptors located at the hair follicle. DHT is produced by conversion of testosterone using an enzyme called 5-alpha reductase type 2, an enzyme located in the folliculodermal papilla. Now, what is the mechanism of action of finasteride? It's the DHT inhibition. The primary mechanism of finasteride is to reduce the levels of DHT in the scalp. Finasteride works by competitively inhibiting 5-alpha reductase type 2, resulting in the inhibition of the conversion of testosterone to DHT. Finasteride helps to slow down or even reverse hair loss in some individuals. It does this by preventing further miniaturization of hair follicles. Finasteride is considered as an effective treatment for male pattern baldness. Finasteride can help preserve existing hair and prevent further hair loss. This can be especially valuable for individuals in the early stages of hair thinning. Finasteride is taken orally as a daily medication, making it relatively convenient to use for most patients. Important considerations. Finasteride is available by prescription only and should be prescribed and monitored by a healthcare provider. A result with finasteride may take several months to become noticeable. It is not a quick fix. Also, discontinuing the medication can lead to a gradual reversal of the effects, with hair loss returning to its previous pattern. Now, something really important. There are potential side effects of this drug. Finasteride can have side effects in some individuals. Side effects such as decreased libido, erectile dysfunction, reduced ejaculate volume, gynecomastia, and others may occur. Also, it's crucial to consult with a qualified healthcare provider. They can evaluate your specific condition, discuss potential side effects, and monitor your progress while on the treatment. I hope this video was informative for you. If you want to see such type of content, please like, share, subscribe, and hit the notification bell for more videos like this. See you next time. Bye!